Hi, I'm Amber, and I'm going to demonstrate how to start IV maintenance, and IV medications. First, I'm going to tell you the 12 safety principles. They are verify your order, provide good hand washing before and after patient care, um, verify your policies, your facilities policy and procedure, and assemble your equipment. Consult the manufacturer if needed regarding the equipment. Um, Knock on your patient's door. Identify your patient with two identifiers. Explain the procedure and provide for privacy. Um, Raise the bed for good body mechanics. Don any PPE if needed. Look at the overall condition of your patient. After completion, make sure you lower the bed back to uh, what the bed was before. Raise the side rails. If it's care plan, give the patient the call light and document any abnormal findings if you find any. First, I'm going to demonstrate on how to start an IV. First, you would want to put your gloves on. Then you would want to assess your patient's arm for a vein. So once you find a good vein, you would want to clean it. Make sure you squeeze these together and pop them. Shake it. And then clean the vein in a circular motion. Then you're going to let it dry for about 3 minutes. While you're letting it dry, you're going to go ahead and get your equipment together. Um, I didn't say when I'm finding my vein, I would apply my tourniquet and then take my tourniquet off. Right now, I'm going to prime my tubing. Okay. And then I'm going to go ahead and apply my tourniquet again to my arm. And then I'm going to get my needle. And always make sure it is bevel up. And then you're going to advance your needle into your vein until you get blood return. And then once you get blood return, you're going to advance it and then apply pressure and release your tourniquet. And then you're going to connect your tubing and flush it just to make sure it's going to be good. Pull back and see if you get blood return. You can go ahead and flush it with 10 cc's if you want to. Then you want to go ahead and apply your dressing. And you can flush it again just to make sure it's still patent. Then you can tape it up to the side or however you want to do it, just to secure it. You want to make sure that you look for any signs of infiltration, redness, edema, swelling, anything like that. Then of course you want to document the site, what gauge you used, how they tolerated. What else? And then you want to initial, date, and time your dressing, and then remove your gloves and wash your hands. Okay. Now we are going to give IV morphine. We have an order from the doctor that says give morphine 2 milligrams IV push times 1 dose stat. So I'm going to pretend this is my IV morphine. Just want to make sure that my patient isn't allergic to morphine, and then I'm going to say my 6 medication rights, and it's the right patient, right route, right dose, right time, right documentation, and right med. Then I would just assess the site, make sure that it's patent, don't have any infiltration, redness, swelling. Go ahead and I would scrub the hub with alcohol and then explain to the patient what I'm going to do, and go ahead and flush it with 10 cc's of normal saline after you unlock the safety lock on it. Then you could clamp it back and then say this is your morphine, and it's 2 milligrams, so you would go ahead and administer the 2 milligrams of morphine, but you would want to administer 1 milliliter per minute. So you would want to give it over 2 minutes. Then as you're giving it, you just want to assess the patient for any hypotension, watch the respirations, anything like that. Go ahead and clamp it back, and then get another 10 cc normal saline flush and unclamp it and flush it again, and then reclamp it and document what you did, what you gave, how the patient tolerated. And then you would look at your doctor's order again And we have an order to begin normal saline at 150 cc's an hour for 8 hours. So,
What was that?
once again, you would just assess your
What truck is that?
IV site, make sure it's patent, there's not any infiltration, no swelling, no edema, no redness. You would go ahead and have your fluids ready, hang them, go ahead and prime your IV tubing to make sure all the air bubbles are out, make sure the tubing is patent. No holes or anything like that. Once you do that, you can go ahead and get your flow rate, which will be 150 milliliters per hour. Go ahead and hook that up to your patient. Unclamp it and go ahead and start infusing it at 150 milliliters per hour, and just make sure that you document what you did and what you started, and make sure that you assess the patient throughout your shift. And that is all.